The gut microbiota is involved in a number of colonic dysfunctions, among which IBS, IBD, constipation and bloating belong to the most common ones. As the gut microbiota is involved in the control of the local immune system and inflammation control, it is likely to take part in the development of IBS and IBD. However, it is not easy to determine how dysbiosis and diseases are related to each other in terms of cause and consequence. IBS patients do not have a specific gut microbiota profile. However, several studies report certain commonalities. These patients' gut microbiota composition is characterized by an increase in Firmicutes, Ruminococcus, Gamma proteobacteria, and Clostridium species, and a decrease in Bacteroidetes and Bifidobacterium. Moreover, certain species involved in inflammation control, such as Faecalibacterium prausnitzi, disappear completely. Still, it is too early to derive definitive clinical criteria from the gut microbiota composition and to determine which of its changes are causes or consequences of the disease. At present, the scientific community assumes that the absence of Faecalibacterium prausnitzi and a general reduction of gut microbial diversity can be considered markers of an increased risk to develop chronic IBS. At the same time, it could be shown that a reverse modulation of the gut microbiota can improve IBS. This slide shows the results of the analysis of fecal samples from 62 patients with IBS and from 46 healthy controls. The changes of the intestinal microbiota that are connected with the disease are clearly visible. The microbiota of patients compared to that of controls has a twofold increased ratio of Firmicutes to Bacteroidetes. This results from an approximately 1.5-fold increase in numbers of Doria, Ruminococcus, and Clostridium spp, a 2-fold decrease in the number of Bacteroidetes, a 1.5-fold decrease in numbers of Bifidobacterium and Faecalibacterium spp, and, if present, a 4-fold lower average number of methanogens. Not all IBS patients have a gut microbiota profile that differs from that of healthy individuals. Others, though, show a deviating microbial composition that can be clustered into subgroups according to the proportions of phyla and genera. These correspond to IBS clusters 2 and 1 on the slide. So far, however, the monitoring of the gut microbiota in IBS has merely been a topic of research without therapeutic consequences. A recent meta-analysis based on 6 randomized control trials provides evidence of the therapeutic efficacy of certain probiotics. These can modulate the gut microbiota and induce a significant overall improvement of IBS symptoms. So certain probiotics are likely to be helpful in the management of IBS. The following slides show how this applies to specific IBS-related symptoms, such as abdominal pain, flatulence, and bloating. The interplay between the different sorts of bacteria that form the gut microbiota is rather intricate. According to a meta-analysis summarized by this slide, Bifidobacteria, when alone or in association with other bacteria, are more active than Lactobacilli alone. Recently, a number of studies and recommendations concerning the role of probiotics in the management of IBS have been published. There is a high level of agreement among various official bodies that some probiotics can serve as a safe and worthwhile adjuvant. Consequently, a number of probiotics is now being included in the management schemes of IBS. In addition to the references listed on this slide, there are many national guidelines which are easily available for practitioners in their respective countries. Similar to other intestinal diseases, the gut profiles of IBD patients show a reduced diversity. But they do not only differ from healthy individuals' profiles, but also from those of IBS patients. The main difference? They show a decrease in Firmicutes and an increase in Enterobacteria. But there are also some commonalities with IBS-related changes. These include an increase in gamma-proteobacteria and Clostridium difficile, and a decrease in diversity, including Fecalibacterium prausnitzii, which might even disappear completely. This is an indicator of higher risk of chronicity of IBD and of the risk of relapse. Another significant marker for an IBD-affected gut microbiota is an increase in the amount of E. coli. Recent Cochrane reviews conclude that the probiotics tested so far have not been able to provide a better effect than the classical cure. Focusing on ulcerative colitis, this slide shows that none of the few tested probiotics provide a better effect on relapse prevention than the current treatment with mesalazine. Digestive symptoms such as constipation and bloating cause considerable gut discomfort. The gut microbiota is part of the underlying physiopathology. The gut microbiota of IBS constipated individuals differs from that of controls. It shows a decrease in hydrogen-utilizing microbes such as Rosaburia. The slide shows the outcome of a randomized control trial with 34 constipated IBS patients. One subgroup received a fermented milk product containing the probiotic Bifidobacterium lactis over the course of 4 weeks, while the other group consumed a control product. The probiotic reduced the gut transit time considerably as compared to controls. Bloating is the result of gas production through gut microbes and the utilization of these gases by other gut microbes. An additional factor is the muscular resistance to dilation. This slide shows the effect of a fermented milk product containing Bifidobacterium lactis. The intake of this probiotic decreased bloating in IBS constipated patients, according to their subjective perception, as well as to the objective measurement of the abdominal distension. This suggests that IBS patients with these symptoms can benefit from the intake of probiotics. A modulation of the gut microbiota can be achieved by prebiotics, which are substances that promote the growth of beneficial gut bacteria, by antibiotics, which reduce the amount of certain disease-related bacterial species, by probiotics, which add certain beneficial species or substitute missing ones, by symbiotics, which combine the benefits of pre- and probiotics. The importance of gut microbiota modulation in the treatment of gut disorders is going to increase in the coming years. Gastroenterologists are well advised to take this development into account. Doctors and patients should regard the gut microbiota as an important player when it comes to digestive health management.